So I guess
So yeah,
welcome home. I mean, I guess
thank
Shanghai
you.
is
Yeah.
home now, but
Yep.
yeah. Um,
Yeah.
First of all, you're quarantined at home.
Yeah. Well, I am in self quarantine, so nothing mandated, but as a good practice and as advised at the when I flew in, I'm staying home for 14 days, which then I leave and go back. So essentially, I'm spending my whole time here in my house. Yeah.
That's
Yeah.
probably not exactly what you planned. You might have wanted to go on a hike or something, huh? Or
Yeah, I've gone outside when there's nobody around, but yeah, I'm here to see my family, and that's what I'm doing. But I'm not going to any public areas at
yeah.
all.
Well, it seems like
Yeah.
you should be able to go outside if nobody's around. But yeah, obviously
Yep.
you know the rules.
Mhm. Yeah.
So tell us a little bit about your experience in China and what
Sure.
you saw happening.
Yeah, you bet. So my background is I practiced here in the Northwest until 2016, and I moved to Shanghai, and my family came. I'd practiced at Adventist before moving. So I'm a family physician in a multi-specialty hospital in Shanghai. It's a smaller hospital, about 40 beds at my previous hospital. I'm the head of uh, I'm the chief of family medicine at United Family Hospital in Shanghai, and I had formerly been the chief of infection control. So that's the specialty that prevents transmission of infections within the hospital. It's not infectious disease. Infectious disease doctors treat infectious diseases, but I was active in preventing spread of infection. And
Wow.
we'd had a measles outbreak actually in the international schools last May and June in Shanghai that I worked very closely with the Shanghai Centers for Disease Control to stop that. So that's my background. In January, the first reports of a novel coronavirus were becoming public, and the December 31st, I think, is when the WHO gave the first notice. Early January, then I was reading about this new novel coronavirus in Wuhan, in Hubei, which is I don't know how many kilometers. Anyway, it's a province in Hubei is the province, Wuhan is the city, and the outbreak started there. And by mid-January, the news was it really cases were coming in. News of cases were coming in rapidly, and in Shanghai, we were preparing. So January 23rd is when Wuhan went on lockdown. So that's when the Chinese government
Hmm.
suspended any travel in or out of Shanghai. And that's right before Chinese New Year.
Right.
So over that New Year holiday, we were on deck, on duty, planning for the potential for the virus to arrive in Shanghai. So I've been working with our hospital leadership and the Shanghai Centers for Disease Control since um, late January to prepare for what if we have a patient with coronavirus show up at our hospital? What are the measures we need to take to prevent transmission within the hospital? And then just living through what the community is doing in China. So, the slowdown in all public activities, businesses being closed, movie theaters, karaoke, schools being closed. So it was a dramatic and sudden change in daily life starting in uh, late January, and it's just now recovering. The Chinese healthcare system is largely a public system with some private hospitals with very centralized control. So they can direct patients to go where they need to go. They can open clinics, close clinics. So we have not knowingly seen any patients with coronavirus because they are directed to the public fever hospitals.
Sure.
Now, I say knowingly because 80% of people with coronavirus will have pretty mild symptoms, and some may have none. So we have been seeing patients with coughs and colds without fever and without travel to endemic areas. But when we see those patients, we've been wearing the full protective gear, the mask, the not the suits, but the visors, the
Hmm.
goggles. We've been treating every patient with a cough and cold as if they could have coronavirus, though the highest risk people have been directed elsewhere.
Yeah.
Yeah.
Um, so the, let's get to the nitty gritty. I mean, it
Yep.
seems like the Chinese response was pretty strong
Yeah.
and has been
Hmm.
fairly effective considering. I don't know.
Yeah.
How would you? I don't
Yeah.
want to describe it. How would you describe it?
Yeah. So yeah, it's so far it's the only place that's seen the cases fall from 2,000 new cases a day to almost none. So what we see is the response has worked. Now, right now, I don't think it's useful to spend a lot of time looking at the earliest response and what could have been done better and but I think it's really important now to focus on what did work, and that was a really dramatic change in everyday life. So that meant keeping people home, closing even businesses like going to the hairdresser, massage, dental. Our dental clinic is just now reopening after 6 weeks. So really profound change in everyday life, and it is working because there's no medicine. There's trials underway, but there's no universal protocol for treating this. There's no vaccine. The only tool we have is to keep people apart.
So through this lens that you have,
Mhm.
how are we
Mhm.
doing in this country?
Yeah. So I was really heartened to see that the NBA took the lead and canceled their season. I mean, that's a terribly difficult decision, and um, involves billions of dollars. A lot of people are going to suffer. People who work at the games aren't going to have a job. But that is, as painful as that is, it's going to take measures like that to begin to slow down the numbers. Um, what I have been talking to healthcare leaders about here is how do we reorganize the system in a way that you can attack this at a regional level. So you're not going to solve this on a practice by practice level. It's going to take getting a regional area to cooperate, designate where are patients with suspect coronavirus going to go. How do you keep them totally separate from all the well care? Children need to get their vaccinations. They need to continue that, but we don't want a patient with cough and cold sitting next to an infant in the waiting
Right.
room. So that segregation can happen on a practice level, but it's not going to be efficient. And it's going to take a lot more protective equipment, masks, gear, and everything. If you have to suit up every one physician to go from cough, cold to well care, but it's going to take actually a really pretty massive reorganization, I think, to be the most efficient and steer patients across networks to um, locations that are going to have the best setup for preventing transmission of infection.
Are we at all nimble enough and able to change like that in this country? I mean, it's not our system to do
Right,
so.
right. So there, the level of ingenuity here, the great minds working on this. I mean, there is absolutely a will to do this, and if we can trust the people in the healthcare industry, the physicians and the front line, um, to make those changes, to get paid for telemedicine, to be able to work across networks, we can do it. But it's going to take um, a, a lot of it's going to take a lot of will on some major stakeholders, right, from some major stakeholders right now to make the changes. I think we can do it, but it takes a totally new way of thinking because we've never faced anything like this before, certainly not in my lifetime, and maybe not since 1918.
Yeah. Um, you've seen firsthand. What do you say to people that
Mhm.
say, "Well, I don't see what the big deal is. There may be a lot of people that get infected, but it's for most of them, it's not even going to bother them." I mean, what's your response
Right,
to that
right,
thinking?
right. So most people will be fine, yes. the mortality is a lot higher than influenza. But what worries me is there are a lot of people who will survive but need critical care on the way. So you have people who are needing intensive medical services. And if you have several people needing that all at once, there's just not going to be the capacity. Um, the risk to healthcare providers also is substantial. And if you have a physician, if you have a nurse off duty and now needing care, not only are they not available for care, but they're actually needing those resources
Right.
themselves. So that's the big deal is 5% of patients needing critical care. If it's only 100 people with the infection, it's not a big deal. But if it's most of the population, it's a
Yeah.
huge
And
deal.
if we have
It's a huge deal.
100 million Americans or something,
Yeah,
yeah.
yeah, yeah, yeah.
So how
Mhm.
about our federal government response? I mean, it seems like testing's a big issue.
Mhm.
I don't know. Can you weigh in
Yeah,
on that?
yeah, yeah. So the kind of coordination we need now, I would love to see a lot more leadership on how do we make it feasible for people who have been exposed to stay home. If you don't have paid sick leave, if you have a child you need to take to school, if you don't have a backup childcare plan, how do you make it happen? If you're vulnerable elderly, how are you going to be able to be safe? So this is a time when we need leadership and planning to say we need to keep people apart and keep them protected, and you can't do that on your own. And physicians need and nurses need the protection to be able to do their job safely, and that's where we need the leadership. So I'm proud of what Jay Inslee is doing. I'm happy to see that governors and local leaders are taking up the slack, but there's a void at the top, I'd say.
Yeah.
Mm.
Where do you see this going?
Mhm.
I mean,
Yeah.
I know, I guess it could
Mm.
go if we really
Yeah.
limit social contact, the curve, talk
Hmm.
about flattening the
Hmm.
curve, but are
Flattening the
we going to
curve.
be able to? And if we don't, what do you
Yeah.
see?
Yeah. Oof. So that's a really good question. I would say it's a good time now to make contingency plans for if schools are closed. I really want to get the message out. It's time for everybody to be checking on their neighbors. Do you have vulnerable um, friends and family who'll need your support? Do you have an elderly neighbor who could benefit from some grocery deliveries? And you can take care of people without risk. It means leaving groceries at a door and knock on the door and leave, no risk of infection. So where is this going to go? I think the virus will continue to spread in that as long as there are people who are susceptible, which is at this point we think pretty much everybody. um, there will continue to be infections. So it's only the isolation, the keeping people apart that will work. So it's not too late. It's not too late for people to make a difference. And I think that's really important, that people don't throw up their hands now and say we can't do anything. So yes, people need to isolate and stay home, but there are going to be safe ways to take care of each other. And I think that's where we need to focus is what can each one person do to reduce the spread, to take care of themselves. If you smoke, quit smoking. That's I'm not seeing that advice out there, but we know that
Sure.
uh, that doesn't
Respiratory.
help lung disease.
Yeah,
Yeah,
yeah, for
respiratory.
sure.
Yeah, so if everybody can do their part to stay healthy, if you have high blood pressure, take your medicine. What we want is to leave capacity in the hospital system for what we anticipate will be a lot more serious illnesses. So don't do your elective knee surgery right now. Um, if you don't absolutely need to use the healthcare system, this would be a time to consult with your primary care physician and see, can you delay
Yeah,
a planned procedure?
yeah,
We need to take this seriously.
yeah.
And while we're a different society, we're not the same
Right.
as China. We can't impose the same level of control, but let's look at what worked and go from there and take best practices and learn from that.
Well said, all of it. I appreciate it. Yeah.
Yeah, you bet.
I could ask
Yeah,
you one more thing.
absolutely.
When you go back to Shanghai pretty soon,
Hmm.
what do you anticipate finding by the time you get home? Are
Yeah,
things going to
yeah,
continue to?
yeah. So Shanghai is actually slowly returning to normal. Schools are not open yet, but businesses are reopening. Our dental clinic is reopening. But we'll still be being extremely careful and wearing personal protective equipment for every respiratory infection, masks with every patient. So life is still really impacted in
Yeah.
Shanghai. So it's not back to normal and won't be for some while yet.
I've got a daughter at University of Washington. She's home.
Ah,
She's home a week earlier than the spring break because
yeah.
online stuff she's doing
Mhm,
at home now.
mhm.
But she's in a dorm up there. I mean,
Yeah.
but so no
Mhm,
classes, but the dorms are still
mhm,
open. And I mean, I don't know where you weigh in
mhm.
on this.
Yeah.
Should all public schools be closed? I have a daughter in Vancouver schools too.
Right.
So
Right. Right. It's an agonizing decision because the downside of closing is substantial. I mean, where are these kids going to go? Kids who need a meal.
yeah,
But my message to the community would be, for those families who do have a homemaker at home, is there another child you can take in during the day?
yeah,
Can we all help out? Can we watch each other's families to allow schools to close and allow that social distancing? And I want families to plan now
yeah,
for it because while children are not getting very sick, we presume they're probably a pretty substantial reservoir to continue to spread it.
yeah,
Mm,
yeah.
yeah,
That's one. I know that's the thing that seems so kind of
yeah,
dangerous about this thing is there's so many people
yeah,
that are have very mild symptoms, or maybe they're even
hmm,
kids. They're
yeah,
asymptomatic. They're all
yeah,
together, and they're just it can spread it, and we
hmm,
don't even
hmm.
know. And they can't
We
be
don't
tested
know.
because we don't have enough tests anyway. But even if we did,
Right,
they don't seem to show. Like I mean, my
right.
personal example: my daughter
Hmm.
and her
Yeah,
boyfriend, both up at UW. A week ago, they both had a little sore throat,
right.
a little fever, and a
Yeah,
little bit of a cough,
right.
but
We
it
don't
didn't
know.
really rise to too big a level.
Yeah,
Now we were just talking about last night. If there were an easy test and we could test her, of course we'd test her just to rule it
yeah,
out,
yeah.
and then
Right,
be done. And who knows? We might find out she
right,
actually is a carrier, and
right,
then we're all
right.
need to think of. So it's a
Right.
tricky
It's
thing.
really tough. I mean, it's great on the one hand that almost all cases are mild, but
Sure.
the broad spectrum of disease makes this really difficult.
Yeah.
Communities need to be planning for mass respiratory events right now for a lot of people with severe respiratory disease, and I think they are. And my message would be for people to be really patient if they don't have an urgent medical need,
Hmm.
to be accommodating, to be patient, to try and um, work with their physician to take the best care of their health that they can while needing minimal time in the office. So if you do have a common cold right now, stay home.
Yeah.
Ask for advice if you need to, but your primary care doctor is probably not set up yet to test for coronavirus. There's no treatment that will make you better faster if it's common cold or coronavirus. So if it's mild, stay home, isolate yourself, wash your hands, cough etiquette. But we want to free up capacity for the people who are going to need it.